Oh boy, thank you so much for being here. Is this one working? Okay, so then do I have to turn this one off or you done that? Okay, good, all right. Because I don't want to hold my notes, and I don't believe in teleprompters. Anyway, I see a lot of familiar faces here, and I also see a lot of new faces here. And I'm just so honored that you would take your time and be here tonight with us to both celebrate freedom and also to support freedom. And Steve is right. These next 2 years are going to be so critical in what happens and what's going to happen for the long run and the long term of this country. Because when I look at healthcare, I think about healthcare and I know, and ever since this organization started, I'm a nurse by training, an ER nurse, pediatric ER nurse, and for me, healthcare was always not as much about, quote, healthcare, but I knew that when the government took over healthcare, it took over your life. It would make decisions about when you lived and when you died and who got what and when and where and from whom. And we can see it now very clearly, if we never saw it before, in lots of the words in the 2,700-page bill called Obamacare. So before I go into talking about the next steps for our organization, so you can see, have an idea of what we've done this year, if you haven't heard, but also know where we're going, I need to make just some thank yous, because I'm the first person up here to really give thank yous. And we do have thank yous. I'm very thankful to my board of directors, who are essential to me, essential to what they provide in advice and just how supportive they are in the daily functions of the organization. And and all the names are in the back of the program. I want to thank our sponsors, without which we would not have this wonderful event. So please put a round of applause to them, because I am so thankful for them. And our donors. Okay, and I'd like to recognize as well the legislators and candidates here. And I just want to say, the legislators and candidates, I know there's some here who didn't win, but I just want you to know that I appreciate everything you did trying to do it. And I want to say, Mary Franson, Representative Mary Franson, wherever you are, she won by 1 vote. The recount is coming, and we hope that she will sail through, because she has been a beacon of freedom in the U.S. In the U.S. House, Mary, U.S. House. No, in the Minnesota House. Okay, so I wanted to also say a thank you to all the doctors and the dentists here. I don't think we've ever had as many in one of our events, and there is so much at stake for patients and doctors, and for the practice of medicine in particular, that it's really important that everybody is engaged in order to save the patient-doctor relationship and to save the practice of medicine for the purpose of patient care and not for all sorts of other things. So I know the election results were difficult to swallow, but I'm ready to engage in the upcoming battle. And I'm actually very excited about what the possibilities are. But first, I want to talk to you just about our successes. And I know there's a lot of people in here who know some of them, and I know there's people in here who know nothing, because I don't know your names at all, and I don't think we've ever talked. And so I'm glad you're here, and I'm just going to tell you a little bit about what we did in the last year. So in the past session, we stopped a variety of Obamacare exchange-related bills. We got an amendment voted on to repeal the requirement that doctors and dentists take care of Medicaid patients or lose access to all government employees. And we have tried for a long time to get that, and it was Senator Gretchen Hoffman who really pushed to make that happen. And we are going to miss her at the legislature. And then we also prevented insurance companies from gaining access to information on who has fishing and hunting licenses, because we said our guess would be that what they would do when they were doing their research is find out who had them and then maybe jack up their premiums. So we stopped that. Then in the Wisconsin Senate, you may not know this, but they gave me, as president of CCHF, an official citation for helping them stop Obamacare. In short, the Wisconsin Tea Party came to me when there were very few hours left of a bill, and I managed to talk to some of the legislators involved, and we averted that bill. Then Governor Scott Walker came to Minneapolis, and I got the opportunity to ask him to do something. I said, will you use your soft-spoken, it was at an event, and it was during Q&A. I said, will you use your soft-spoken manner and your steely resolve to stop the Obamacare exchange in your state? And he promised to do so. But I found out from Wisconsin that $1 million had already been spent to build it. So I sent him a letter with a screenshot in the letter of the $1 million. And I told him, I said, you probably don't know what your administration is doing, but here's the evidence. And I asked him again to stop the exchange. And within a week, he had sent the money back to the federal government. So that was a great surprise and a great thing. Also last session, Minnesota passed a law requiring consent for the storage and use of baby DNA. And now I know everybody in this room doesn't have any idea what baby DNA is, but we discovered it back in 2003. We discovered the fact that Minnesota had started storing the DNA of every child born since 1997. And they started storing the genetic test results 10 years before that. And we worked for 8 years, and we pulled a bunch of parents together, 9 families, and they sued eventually, 6 years later after we discovered it, and we couldn't get it undone. They sued the Department of Health, and then they won a year ago tomorrow. Tomorrow is the first anniversary of the Supreme Court ruling against the state of Minnesota, and soon all those DNA cards, 1 million children, some of them already adults, are going to be destroyed. But there is much more to be done on this, and I just need you to know that the people who want it, the researchers and the government officials who want every state to store it, are coming out with new studies to say why parents shouldn't have any consent over the DNA of their children. But I'm here to tell you that there have also been some new studies in the last month that have come out and said we need to have consent not only for the storage and use, but also for the screening. And they have come up with the reasons that our organization has been talking about, but kind of left behind as we dealt with the storage issue. But just about the screening too, and everything that is found out in screening that parents have no idea is being found out on them and why they should have consent over it. So we have more work to do, and with your support, we will continue to work on this issue. There are only 6 states that have any laws, and there are at least 18 states that are storing it without any consent. And when parents find out, they are aghast. They think it should be illegal, and it should be. So we will work more to deal with that issue. Now, our organization is an information organization, and what we're trying to do is change the hearts and minds of people to understand more what healthcare actually means and what's really happening, because all they hear about is in the news. So we have certain things that you have heard. You've heard one of them tonight, the Health Freedom Minute. We have the Health Freedom Minute, and last year it was in 144 states. This year it was in 144 states. See, you know, that's just like Obama's 57 states, right? I don't know, I guess there's 194 countries, but no. It's in 144 stations across the country. And then this year in 246 stations across the country. It's in, and just 2 days ago, a New York network with 4 stations decided they wanted to air it. So we'll now be up to 250 stations in 38 states. And we are headed for 50. And it's our purpose to inform people, because we are trying to change the mindset. You know, the mindset is so much about entitlement and that sort of thing. And the only way you can really get people to understand what's happening is to give them a little bit. So what we're talking about here is 60 seconds of information. And so one of the things that we want to do with this information is we want to change the mindset. We want to move healthcare from the business of healthcare to the mission of medicine. We want to go back to the mission of medicine and leave all the bureaucracy, all the paperwork, all this stuff that is getting in the way of the patient and the doctor, and move in that direction. We also want to move healthcare to so that it is patient-friendly, mission-minded, market-based, pocketbook priced, and based on the U.S. Constitution, not imposed outside of it. Now this year, you may not know, some of you are probably on it, but we started the CCHF Health Freedom e-news, and it's a weekly e-newsletter, and I just want to tell you that the response has been incredible. So since November 1st, 2 weeks ago, are you ready for this? We've received new subscribers from Arkansas, Alabama, Arizona, California, Colorado, Florida, Indiana, Maryland, Michigan, Minnesota, Mississippi, Missouri, Nevada, New York, Ohio, Oklahoma, Oregon, Pennsylvania, Tennessee, Texas, Washington, and Wisconsin. And just 2 weeks. So one Pennsylvania talk show host calls it one of the wittiest newsletters that he gets. As I said, one of the things we like to do is information. I just want to say that in Washington, D.C., went there this summer for the second time, did a congressional briefing, met with U.S. Senator Rand Paul, with Congressman Tom Price, who's a physician, met with Congresswoman Michelle Bachmann and several others, and a whole bunch of staffers. And the whole idea here is to try to get them to understand how the tools of control in healthcare is the data. And we are trying to get them to understand that this whole move to mandate electronic medical records for everyone, to put all our medical records online, because of HIPAA, the so-called privacy rule, which isn't, 2.2 million entities will have access to our medical information once it is online. That is a federal number from a federal regulation. 2.2 million entities. And all of this will be used to control. It will be used to monitor the doctor. It will be used to monitor the patient. It will be used to profile the patient and the doctor. It will be used as research to those who want to do rationing-based research, to say why our healthcare should be rationed away from us, and to make it difficult for make it difficult for doctors to actually deal with us as individuals, because they are being watched. Just think of the government over their shoulder all the time, deciding who has practiced medicine the right way and who hasn't practiced medicine the right way. And you may or may not know it, but Obamacare has a tiny little section in it. These tiny little sections can be awful. In this particular section, it allows the health plan to decide if a doctor isn't doing quality medicine, and then to deny that doctor to a patient. You can't have that doctor because we don't think he's quality medicine. And what is quality medicine? Who gets to define that term? The only ones who get to define that term are the government and the health plans. And usually that means following the universal one-size-fits-all protocol, or it means following whatever the government says has to happen. And if you talk to a doctor, often they will talk to you about how they hate protocols. But yet Obamacare is pushing protocols, and Sarah Palin's 2 death panels. Those 2 death panels are going to use our medicine. One is our medical records. One is called PCORI, Patient-Centered Outcomes Research Institute, to do rationing-based research. And the other one is the Independent Payment Advisory Board, which is going to decide how much doctors can be paid for, and what will be paid for, and what won't be paid for. And so, you know, our organization really is trying to get rid of Obamacare, right? And I know you're thinking about we're going to have it for the next 4 years. But the fact of the matter is, even though we have it for the next 4 years, it doesn't mean that they are going to successfully be able to implement it. So let me just move here into the next steps. I think that we have to be sufficiently prepared to look at what the Achilles heels are of Obamacare. And Obamacare does have Achilles heels. And one of its biggest Achilles heels is called the health insurance exchange. Now, I know from talking to people that there's a lot of people who have no idea what a health insurance exchange is. But I'm going to tell you. I'm going to tell you what they say it is, and I'm going to tell you what we know it is. And that's going to help you to understand why the next steps are so important about what we are going to do. So the health insurance exchange is essentially, here's what they say it is. They say it's a one-stop shopping place, an online tool for people to buy health insurance. Simple, easy, innocuous, nothing going on there, right? Right. Here's what we know about it. What we know is the health insurance exchange is, let's just talk about the state one first, because what Obamacare says is every state shall put in a health insurance exchange. But of course, that would be unconstitutional commandeering of the state. Now, it seems to me that there are several governors who just don't realize they don't have to follow what the law says. And it's really clear that the people who wrote Obamacare know that they cannot force any state to put in the exchange because they have a fallback plan. Any state who refuses to put in the exchange will then get the exchange that the federal government will create and run. Well, so this is how the exchange looks, and I just need you to see it as the beast that it is. In every state, and there's a diagram, and I think it's on our table outside, that we created, and people are now starting to use in different states. What it really is, it's an online website that is a data collector. And if you envision the exchange, we call it a national exchange. If you envision this thing, it's called a Federal Data Services Hub in the middle. And then envision lines going out to every state. And in every state there's a little circle. And that's the state-based exchange. And then all the data goes up to the Federal Data Services Hub. And then the Federal Data Services Hub sends it to all the federal agencies. Homeland Security, HHS, the IRS, the Treasury, the HHS, well anyway, there's a bunch of them. And they're gonna get all our data. And this whole thing is actually meant to push Obamacare into the states. It is the controlling piece, it is the command and control center. It is how they will regulate, it is how the IRS will know who is insured and who isn't. We call it a national registration of insurance status and an IRS enforcement tool. That is its purpose. And the way you register is by buying insurance or having your employer buy insurance or going on there and registering for an exemption. And then they will know. And the reason that we really came to realize what big of a system this was is when one of the regulators here in Minnesota, when I was looking at some of their stuff and I said, so how are you going to get, why are you looking at voter records? And then I said, so are you planning to pre-populate the exchange? And he said, yeah. So they're going to go and find out every piece of data that they can find out on everyone in this state and pre-populate. And if you want to know how extensive this is, you just need to look at the Maximus contract, which you may not know, but the governor is creating an exchange even though there's no legislative authority to do so. And the contract of Maximus says that they will get access to the following data on you. Public data, private data, non-public data, confidential data, medical records data, individually identifiable health data, tax records, any record that is called a record under the Federal Privacy Act, and any other record that the state decides that they should have. So this is not a place for you to just go buy insurance, right? And so our biggest initiative for this coming year is to stop the exchanges. And there's a quote I have here, if I were actually following my notes, which I'm not, which is always a bad sign. I was just feeling like not doing it. There's a quote here we go. Robert Lazewski, President of Health Policy and Strategy Associates, says the following. The ACA, Obamacare, the ACA cannot be implemented without an insurance exchange in each state. It's a go or a no-go. It's that simple. This was in September. So once again, it's a no or no-go, or a no-go, according to whether or not there's an insurance exchange in each state. And we call these a federal takeover center, because that's really what they are. They're command and control for Obamacare. And so the interesting thing from our organization is because Governor Pawlenty was actually trying to put in an exchange to mimic Mitt Romney back in 2007 and 2008, and we stopped it there when individuals could only buy insurance on the exchange. That was part of the bill that was being proposed. As a result of that, we were so immediately conditioned to worry about this exchange language in Obamacare. And so now we have all these organizations from across the country coming to us. We have legislators. I went to South Dakota to debate on the exchange. A North Dakota committee chairman asked me to send him arguments on the exchange. A woman in Texas asked me for information so she could take it to a GOP legislative chair. So many different states. I'm working with someone in Mississippi to give them information on an RFP and a proposal to build an exchange and what it really means. And so our plan, because we understand that the way to stop Obamacare is to stop the exchange. It's really that simple. No exchange, no Obamacare. And it just doesn't matter that President Obama is in office if we stop the exchange. And wouldn't it be sweet? I mean, we could defeat the exchange while he's we could defeat Obamacare while he's sitting in office. And see, here's the deal. There's a lot of DC organizations, and interestingly enough, the lobbyists, I just read an article that all the DC lobbyists are moving their focus from DC to the states because they understand if the governors don't install the exchanges, then Obamacare doesn't go forward. So this is its Achilles heel. It's absolute Achilles heel. And so now, how to convince the governors and the people of this great nation to go after their governors and their legislators and get that to not happen. So we have this little campaign plan, and you have a little blue bracelet. And this bracelet says exchangeoptout.org. And with your help, it's our plan to do everything we can to have a national campaign where people will actually sign something in really big letters to say they didn't agree to Obamacare, they didn't agree to the exchanges, they did not agree, and they opt out. And here's the deal that you have to understand. Let's just say every state creates an an exchange. Well, what if they build it and no one comes? That's our plan. No one comes. And the exchanges in the history of this country that have been built have failed because people didn't come. They had other options, of course. Now they're not going to have other options, but they have one great option. It's a great option. And I was sitting in the courtroom too. But I was sitting there when the ruling came down. And I listened to Roberts, and I was really excited because he was talking that the whole mandate to purchase health insurance was unconstitutional. It was really exciting. And then he said, but that is not the end of the matter. And I thought, it's not? And so he did something, that we consider awful. But the fact of the matter is, it was declared and is true that you do not have to buy health insurance. And under Obamacare, you can buy it anytime you want. So you can wait until you get sick. And you can pay the nominal fee. And you never have to go to the exchange and be tracked and have your privacy taken away from you. You never have a reason where you have to go to the exchange. And here's the other thing that Goldwater Institute told us in a seminar, a webinar that I was on in Tennessee just on Monday. It was Goldwater Institute, Cato Institute, and we were the three experts in this webinar that Tennessee legislators were listening to. And one of the things that the Goldwater Institute found, another little thing in the bill, and it's actually really amazing, and if you get our e-news, you have seen it. No individual, no company, is required to participate in any federal health care program under this act. Wow. It's 10 lines in my 950-page version. Right? There are some significant Achilles heels in Obamacare, and this is one that we want. We want millions of, I opt out of Obamacare. I opt out of the exchange. You can't do this because we understand that it is building the public's ire and angst that's going to stop Obamacare in its tracks, and we have the power to do it. Stop the exchange, stop Obamacare. That's our big next step. Okay, I'm just going to tell you two other things that are on my mind for what I'd like to do as you're thinking about whether or not you want to fork out any cash for our organization. So, here's one. We really want to, with enough ability, with enough funding, we want to start a weekly, really brief video news program. And we know, if you listen to that list of states that are getting our e-news, and you realize that we have more than 3 million listeners around the country, we know that we can move this exchange opt-out forward. But we also know that there's a whole lot of people looking at video. And what if we come up with a healthcare news program, a brief healthcare news program every week, and gives us more than 1 minute to talk and gives a little bit more information out there. And video has become very, very popular, particularly amongst young people. And we need to reach the young people with the truth of what's happening in this country and what healthcare, how they aren't going to have healthcare, they aren't going to have Medicare, they aren't going to have choices, they aren't going to have insurance choices. A whole bunch of doctors are going to leave. Actually, there's a Health Freedom Minute on doctors, which we should play after I'm done. But lots of doctors are going to leave and they have no reason to stay. And there's no reason a student should become a doctor. There's no reason. If you look at Obamacare, they're under someone else's control after they put all this time, all this money, all their energy, and now they have to take their brain, put it on hold here, and just follow the protocols of the government. There's no reason. So the second thing that I would really like to do with sufficient funding is start this video news program every week. And the third thing is kind of just a dream of mine, but I would really like to make it happen. And that is that I would like our organization to hold a conference for state policy, healthcare experts and leaders around the country. Because here's what's happening to healthcare. And unfortunately, lots of people, even in conservative think tanks, they know nothing about medicine. They know nothing about healthcare. Many of them haven't even been patients. They're not doctors, they're not nurses. And I'm one of the few people who's actually a professional running this. And so I understand patients and I understand how unique they are. And I look at the standardization that is happening under Obamacare, under Medicare, under all of these protocols, one-size-fits-all protocols, and doctors get penalized if they don't follow them. And I think a lot of this is being pushed by conservatives because they're business people. They think you can run healthcare like manufacturing. Like if they just write the right protocol and they just do it for everybody that comes in with the same symptoms, easy. And then that's quality healthcare. But I know that everybody differs, and I know that when you go to the doctor, you don't want something that works for 80% of the people. You want something that works for you. And so I would like to have a real quality seminar, probably every year, given how those healthcare experts change, to teach them from a doctor and a patient and have real experts come in and talk about what healthcare really means and how they are pushing the wrong policy. They are pushing the business of healthcare when they should be pushing the mission of medicine. So those are the three things I wanted to tell you about next steps that our organization would like to take in the future and to move the entire country towards health freedom and to make it pocket friendly. And I just want to add one little thing, which I never even thought about saying to you until right now. I think some of you are really afraid of the cost of healthcare. But I want to tell you, and I know the public is, I want to tell you there are examples, and these are the kind of examples we would bring in a conference. There's the doctor at Patmos Clinic in Tennessee who doesn't take any insurance, has more than 7,000 patients, and has prices that even Medicaid come and pay for. There's a surgical center in Oklahoma that Canadians come to all the time, that people across the country come to all the time. All the prices are listed. They're all listed. They are approximately, and sometimes 80% less than the hospital down the street. They have the most excellent surgeons at the surgical center. This is possible, but we have to change the hearts and the minds, and we have to tell the truth about what is possible in healthcare. And I hope that tonight you might be able to help us move that agenda and that truth forward. Thank you very much.